Hello, doctors and experts. How much do you know about female genital mutilation? Female genital mutilation, FGM for short, refers to all procedures that involve partial or total removal of the female external genitalia for non-medical reasons. Worldwide, over 200 million women and children have undergone FGM. Recent estimates show that over 100,000 women and children in Germany are affected or at risk of FGM. This makes it very likely that you will meet an affected patient in your practice. This film provides an overview of what you need to know regarding FGM in your gynaecological practice. If, for example, you are asked to issue a medical certificate for a case of FGM, this must be in line with WHO guidelines, which distinguish between 4 different types and several subtypes of FGM. Type 1 is defined by WHO as either the removal of the clitoral hood or the partial or complete removal of the tip of the clitoris along with the prepuce. Type 2A refers to the removal of the inner labia. Type 2B is the partial or total removal of the tip of the clitoris and the inner labia. In Type 2C, the outer labia are also removed. Type 3 refers to the narrowing of the vaginal orifice with the creation of a covering seal by cutting and resuturing together either the labia minora or the labia majora. This may be with or without excision of the tip of the clitoris. Finally, Type 4 comprises all other harmful procedures such as pricking, pulling, incision or cauterization. Specialised surgical centres can help you determine the degree of mutilation. Primary and secondary complications of FGM can cause symptoms that are often more far-reaching than gynaecological findings. The most common primary complications include pain, urinary dysfunction, excessive scarring, and injury to the urethra. Secondary complications include dysuria, menstrual cramps, infections, cysts, and incontinence. Those affected often also experience mental health conditions such as anxiety disorders, depression, and sexual dysfunction. There are numerous challenges to caring for patients. Many of those affected are unfamiliar with medical settings. Language and cultural differences can also be barriers. Sensitive and empathetic communication are essential for taking medical histories, carrying out exams, and treatment. Language is also important. Many patients only know the term for FGM in their native language. You can explain the meaning of genital mutilation to your patient so that she can decide for herself which term she wants to use. At times, it may not be possible to carry out gynaecological exams and cystological tests. In these cases, the patient should be informed about the option of deinfibulation. This type of surgery and other reconstructive procedures are discussed in another film in this series. In most cases, your patient will require psychosocial counselling and sexual health education in addition to medical treatment. It is therefore best to refer her to a specialised counselling centre that can offer comprehensive help and organise language interpretation. Pregnant victims of FGM may experience complications. These complications and child protection requirements for newborns are discussed in another episode.
Ça pourrait durer, les choses cachées, le temps nous dira. Ça pourrait durer.